So I'm this pedantic, arrogant, I'll just say I was an arrogant ER doctor. And I just assumed everything that they taught us in medical school was correct. If it wasn't taught in medical school, it wasn't worth a darn. So basically, they teach you, if somebody comes to you and they ask you about something that you'd never heard about in medical school, it's just not true. But my experience was I cut out these processed carbs. I started eating this fermented food. Every medical problem goes away. I'm like, I have to become a researcher and figure out, because my whole life changed. I mean, I'm telling you, every medical problem I had went away. So I don't know what, I'm going to be so upset after doing all this stuff. And that the tech looked down and he says, I don't know who you are, but you are obscenely healthy. And so they showed my scan. I had like very little visceral fat. And so that's how I got started. And we studied it for the next 7 years. We got a grant from the National Science Foundation back in 2015. And we were funded $1.2 million. And we scanned 6,000 Americans, studying one at a time what happens with visceral fat. And so we did that for 7 years, and we became the experts at how to get rid of visceral fat. You got to be able to make money off this, because if you don't make money, your good idea is going nowhere. So that's where we sucked. So, COVID came along. We'd gone through all our bank accounts. We couldn't afford to pay for our employees and the scanner. So it just got all shut down. Super sad. And so I retooled. And now I've figured out a model to how to optimize human beings and make money off of it. And now I want to spread it. You just have to be a human being that wants to help people out, because everything we found out to improve and reduce visceral fat doesn't need prescription drugs, doesn't need medical procedures. It's all lifestyle. So health coaches, personal trainers, just awesome, men and women that want to help out other people can do these things, and you can make money off of it, and people will pay. In my experience, people will pay money to improve their health, because right now they're paying a lot of money and they're falling apart.